I'm Dr. Aniruddha Malpani. I'm an IVF specialist. And I tell everyone, I'm blessed to be a doctor. An IVF doctor actually has the best job in the world. I get women pregnant and their husbands pay me to do that for them. But the fact of the matter is, I'm a second generation doctor, and patients no longer regard doctors with the same respect which they would in the past. I remember they would look up to my parents, and I'm not saying they don't look up to me, but in general, there is a lot of mistrust in the medical profession, and we need to think about what we can do to bridge this doctor-patient trust deficit. And part of the problem is patients today have a love-hate relationship with their doctor. Your individual doctor, someone who's helped you to have a baby, for example, you'll most certainly love. But in general, most patients will say doctors can't be trusted. They do too many tests, they offer too many treatments, they just want to make money, they don't have time to talk to you, and it's a long list of reasons why patients are unhappy with doctors. The commonest solution for all this is, yes, there's a shortage of doctors. We get more doctors, these problems will go away. But actually, that's not true. Just having more doctors won't help, especially if they're bad doctors. I think what we have today is a shortage of well-informed patients. And that's what I'm going to focus on today. Rather than make a list of all the problems, government doesn't provide good quality care, doctors have become greedy, medical education has become too expensive, doctors are just too commercial, I'm going to focus on what patients can do in order to get the doctor to provide them with the best medical care. Really, there's not much point in talking about problems, is there? Let's focus on solutions. But to recap, why are patients so unhappy with their doctors? And multiple reasons again. Doctors are seen to be uncaring because they're too much in a rush. They spend more time treating the lab reports and the scans rather than the patient. They spend more time with their head buried in the computer screen rather than explain to the patient what is going on. Lots of them are extremely expensive, and a lot of the care is very episodic, which means effectively you get bounced from one specialist to a second specialist to a third specialist. So often the doctor doesn't even remember your name, which can be extremely frustrating. And they never tell you what they're doing, why they're doing it. And of course, a lot of this problem has been compounded thanks to the media, which never publishes any stories about the good doctors. It just emphasizes all the bad doctors and how commercial they've become. And this, of course, will just make a bad problem even worse. And it's not just patients who are unhappy with the doctors. Doctors are extremely unhappy with their patients as well. They feel patients demand all their time and their attention. They want instant gratification. They have very unrealistic expectations from what the doctor can do for them. They actually feel unappreciated. They feel we spent 10 years of our life, we're on call all the time, and yet patients don't care. When we save a patient's life, all they say is thank you. But anytime something goes wrong, they drag us to court. And they feel they're bullied by the judiciary, who always takes a very unsympathetic view and always blames the doctor whenever something goes wrong, saying the doctor is negligent or malpractice, when often it's not even the doctor's fault. And of course, for the media, doctors are very popular whipping boys, and doctors don't really have a stand. They can't speak up because they're so scared of the public beating up on them. And that's why you see so many of these stories about doctors being bashed up and hospitals being burnt. And the reality is that doctors don't have any personal life of their own because they're so busy taking care of patients that they feel they've sacrificed everything. And for what? They don't get paid very well, and they don't even get the respect which they used to get in the past. As a result of which, most doctors don't want their children to become doctors anymore, which is such a tragedy. Now, I will accept the fact that there are some bad doctors. I'm not saying all of them are paragons of virtue, but most of them are good. But today what's happened is that doctors get beaten up, police are happy to arrest them no matter whatever happens, hospitals get burned down, and patients will keep on doctor shopping, as a result of which everyone suffers. And that's not really a great solution, because all of us are going to fall sick. All of us require doctors to take care of us. Remember, you were born in a hospital where your doctor helped you to give birth. You'll most likely die in a hospital where there will be a doctor by your bedside in the ICU. And in between, every time you have a problem, you want a doctor to take care of you. And that's what I need to emphasize, that we're both on the same side. Doctors care about patients, which is why doctors became doctors in the first place, not just to make money. Remember, doctors are reasonably smart. There are much easier ways of making much more money. They became doctors because they like taking care of patients and helping them to get better. So what can we do in order to create a win-win situation so that doctors enjoy what they're doing and patients start trusting doctor? And I think there is one simple solution for this, what I call information therapy. And the good thing about information therapy is a doctor doesn't need to prescribe it to you. This is something which you can do for yourself. And information therapy is powerful medicine because it helps patients to make the right decisions for themselves in partnership with the doctor. I think it's the patients who are the largest untapped healthcare resource. And I say untapped because the fact of the matter is that you are the one who's the decision maker. You're the one who decides whether you want to go to a doctor, when to go to a doctor, which doctor to go to. But you're not sure whether you're making the right decisions or not. And we think information therapy can help you. So that information therapy can empower you to become a better patient so that you can find a better doctor and get the right medical care in partnership with your doctor. Please don't underestimate your abilities. You don't need a medical degree. We're not trying to make you a doctor. We just want you to use your own common sense, because the doctor may very well be an expert on all the medical sciences, but you are the expert on your own body. You are the expert on yourself. And the doctor isn't a mind reader. He doesn't know exactly what your problems are. He will take a history, but he doesn't know what your preferences are. And that's why you need to be able to speak up. Remember, knowledge is power. And just like you can't afford to leave everything up to God, you can't afford to leave everything up to your doctor. Your doctor wants you to speak up. He wants you to participate so that he knows he's doing the right thing for you. It's not in the doctor's best interest to have an unhappy patient. Please remember that. How does information therapy help? Multiple ways. First, it promotes self-care, which means the truth is lots of problems, headaches, backaches, cough, cold, fever are self-limited. They'll get better on their own. So you don't need to go running to a doctor for every minor sneeze which you get. But of course, you need to know when to go to a doctor and when not to. And there are lots of times when you can manage your problem for yourself, so you don't need to be dependent on a doctor. And very honestly, a doctor will be happy. If you can fix your own problems for yourself, he doesn't want to be handling all these common fevers if you can do them for yourself. He'd rather be diagnosing more interesting things and more serious diseases. Secondly, information therapy provides evidence-based guidelines, which means it's not arbitrary medicine based on what a doctor feels is right. Because if you go to a good doctor, you're fine. But what happens if you go to an old doctor who's practicing medicine from a 30-year-old textbook and he's never bothered to update himself? This can be dangerous for you. And this means this allows you to ask for the right medical treatment, just the right amount for your preferences, no more and no less. Because too much treatment is a problem, and obviously not enough treatment is a problem as well. And finally, information therapy helps you with a veto power. It allows you to say no, so that if the doctor tells you, hey, you need surgery, you as a patient can say, no, I don't want to do surgery. It allows you to speak up, and you don't need to unnecessarily get cowed down just because the doctor is using jargon, or just because he bullies you, or just because you think of him as the expert. You can say no, and this will help you to prevent over-testing, over-treatment, and unnecessary surgery, and obviously help you to save money as well. I think the trick is you need doctor-patient communication. Just doctors is not enough. And obviously, we try to help patients talk to doctors, but information therapy helps doctors to talk to patients as well. Because if you are a well-informed patient, the doctor will treat you with much more respect. He will appreciate the fact that you've done your homework, you've understood what you're doing, and this will allow him to take far better care for you. And my personal experience, I can definitely say I learn a lot from my patients. The well-informed ones, the ones who've taken the time and the trouble to understand what I'm doing and why I'm doing it. The ones who don't have unrealistic expectations that, hey, IVF has a 100% success rate. Because the reality is, no matter how hard I work, the success rate is never going to be 100%. And that's true all across medicine. Again, remember one thing, if you treat your doctor with respect, your doctor will treat you with respect as well. And I honestly think doctors get the patients they deserve, but patients get the doctors they deserve as well. And well-informed patients are much easier to treat because they have realistic expectations, and both doctor and patient are on the same page. Now, as I said before, there are difficult doctors. There are doctors who take pride in being so busy that they don't have time for you. They have an OPD full of 100 patients and they maybe just have 2 or 3 minutes, or they use jargon, or they overcomplicate matters, or they make you wait forever, or they don't bother to explain. This is a red flag, and a patient who's empowered with information therapy will demand respect from his doctor. And if you're not getting the respect which you deserve, please change your doctor. It's too dangerous for you to go to a doctor who doesn't respect you and all he cares about is the money which you can pay him. What we're trying to emphasize is the quality of a doctor's answer depends on the quality of the questions which you ask him, because doctors aren't mind readers. And here's a simple secret. And even if you remember nothing else, remember that if you need to learn to talk to your doctor safely, you need to be able to tell your doctor your story properly, because 80% of the time the doctor will be able to make the right diagnosis if a well-informed patient tells him the story properly, because all the diagnostic clues are actually within the medical history. We only use tests to confirm the diagnosis. Always remember that. So what does safely mean? It's an acronym where SAFE stands for S, your story. What happened to you? When were you last well? When did the problem start? What makes it better? What makes it worse? What have you tried in the past? Assessment. Patients often know exactly what's going on. And what do you think the problem is? And that helps. It doesn't mean that your diagnosis is correct. You're still paying the doctor and he is the professional expert, but it helps to tell him what you think is going on. F is for fears. What are your anxieties? What are you worried about? If you get chest pain, are you worried that it's a heart attack? Because if you tell your doctor, he'll be able to reassure you properly. And E finally is expectations. What do you expect from your doctor? Do you just expect reassurance, or do you want him to do a lot of tests? And please remember, SAFE is an easy acronym. So how do you talk to your doctor safely? S is for your story. A is for your assessment of your problem. F is what your fears are, and E is what your expectations from your doctor are. But in order to do all this, you need to do your homework, and that's why Dr. Google can be very helpful if you use Dr. Google sensibly. It's great for doing a quick and dirty search, no question about that, but there's a lot of unreliable information available on Dr. Google, and please respect your doctor. No matter how much stuff you've done on Dr. Google, your doctor is still a professional, and therefore you should do your search. You can ask intelligent questions, but don't irritate him by saying, hey, this is what Dr. Google told me, because internet searches can be frustrating for the patient because you get lost, you get confused, there's conflicting information, there's a lot of jargon, you're not sure whom to trust, and equally it can be irritating for the doctor, because then effectively you come to him with, hey, this is what my diagnosis is, and it could be completely wrong. The fact of the matter is, the value which a doctor adds to a patient is a human relationship. A doctor cares for you. He provides you a shoulder to cry on. He provides you a hand which he can hold to help you get better. He helps you interpret everything in context for your life. And remember, that's not something which Dr. Google can do. And that's not something which any technological solution will ever be able to do. And that's why no technology will ever replace the doctor. So please respect him. For the future, I think information therapy will become increasingly widespread. Doctors will start prescribing it online through their own websites. Health insurance companies will proactively provide it, because we all know that prevention is better than cure. And hopefully we'll start seeing a lot of patient educational material in Indian languages so that Indian patients can get access to reliable information. And ideally, this is something which the government of India can do. So it becomes a trusted repository of information. So you can do your homework and then you can check after the consultation whether what the doctor is telling you is right or wrong. I'm sure there are lots of questions you have, because going to a doctor is a big deal, because when you're sick, you want someone who can reassure you, someone who can tell you that he can make everything better. But on the other hand, you don't want to go to a bad doctor who will rip you off or will just do a lot of unnecessary tests and surgeries, because he cares more about optimizing his best interests and making money rather than about yours. And unfortunately, the problem today is with corporate hospitals or with government hospitals which are too busy. A lot of the care has become very depersonalized, and that relationship between the doctor and the patient, the one we used to have in the past, has gradually deteriorated. And there's no point in complaining about things which aren't in your control. But one thing I can promise you, that if you take the time and trouble, your doctor will reciprocate. And good patients will get the good doctors which they deserve. Thank you.